possible.
Well, joining us now in the studio is Adam Roberts, who's the head of economics at the Health Foundation at an independent charity which is working to improve the health service. Good morning. Also with us is Stephen Dorrell, chairman of the NHS Confederation, who's in our London newsroom. Good morning to you, Stephen Dorrell. Thanks very much for talking to us. You heard there Theresa May's comments. It seems like the word crisis is being put aside, that contingency plans are in place, and Theresa May very keen to say that NHS England better prepared for winter than ever before. Is that the feeling you get as someone who is in the system and now a close observer of the system?
Well, it's certainly true that a lot of thought has gone into planning for the winter pressures that are always felt at this time of the year. But what I think is also true is that there are too many examples in different parts of the country where the quality of service that we would want to see for ourselves and for our families is not being delivered. And that, of course, raises questions both about the funding but also about the structure of the way these services are provided. And what I think we need to think about in the longer term, we need to deal with the immediate crisis, but we also need to think in the longer term about how we ensure that the opportunities provided by modern medicine for us all to lead longer and healthier lives, that we prepare ourselves to take advantage of those opportunities rather than convincing ourselves all the time that this is an insupportable burden.
So how does the funding model need to change?
Well, as demand for health and care services, and it's not just hospital services, it's social care, it's a range of care and support services within the community. As demand for those services rises, we need to ensure that there are funding arrangements in place that reflect that rise in demand. That's why, from the NHS Confederation perspective, what we've argued is that we need to have a cross-party review of the funding and structure of health and care services, looking at these services in the longer term in order to ensure that both the funding and the structure are in place to allow us as a society to enjoy what should be the benefits available to us from modern medicine.
Adam, there are some faintly absurd parts in this, in amongst the sort of tragedy of what we know is happening on wards as we speak now. One is that the government's claim is success of a contingency plan that means that people can't have operations, and they're calling that a success. We can plan for a contingency, but apparently we can't plan for the services that are needed.
So the question is why this winter looks so much worse than previous ones. We are 7 years, as I said this morning, 7 years into what would be the most austere decade that the NHS has ever had. So we're already struggling with the finances, a number of trusts looking at deficits yet again. We've also got huge staff shortages. So in an ordinary day, teams across the NHS are having to work that much harder because we haven't trained enough nurses in the past to be able to fill all the vacancies that we've got, for example.
Can I just stop you there? I know you're midway through your point, but you've painted the picture.
Yeah.
Cash, we know, is short, is tight. People are living longer. And then we have the staff issues. These are long-term, effectively permanent issues. These are not going to change in a hurry. So given that those are the issues you're facing, what are the options for making things better?
Well, what are the options? First and foremost, safety is obviously paramount to the NHS. And what we're seeing, a lot of hospitals are reporting an increase in the number of flu cases, an increase in the number of neuroviruses. And that has knock-on implications, because if there's a neurovirus reported on a ward, you have to close the ward. If you've already got people struggling, hospitals struggling to find beds for any ward that you've got to close, has big knock-on effects. Obviously, the staff are people too, and can catch infections. Someone working with vulnerable people obviously can't go into work if they've got any kind of infection that might have knock-on. When you've got short-staffed teams who are having to deal with that, that has
What's the long-term answer to that immediate? Because what we have is, we can ask Stephen Dorrell about this before. He'll have faced this, but in his official role. But you have a long-term problem, but the same problem every year. But it's a long-term problem. So how do you tie those two things together?
So part of it, you can't escape the money, as Mr. Dorrell said. But it's also about the workforce planning. I think it's been widely accepted now across the NHS that the workforce planning that we've done in recent years hasn't been good enough. And that means that we just haven't trained enough of the key staff that we need. We don't have enough nurses across the country to be able to, even if we had more beds, be able to staff them effectively. Most hospitals across the UK are struggling.
And that long-term solution, Stephen Dorrell, comes back again down to money, doesn't it? And funding, and where this money will come from if the NHS is going to remain in its present state.
It does come down to money. It also comes down to structure, because I think it's important when there are pressures in the A&E departments and the pressures for access to emergency wards, people focus quite rightly on hospitals because that's where the pressure point is. But we should recognise that in a sense this is the canary in the mine. This is the warning that the range of public services, not just in hospitals but in GP services, in community services, in social care, in social housing, all of these public services are under stress, and too often people actually present in A&E departments not because they need accident or emergency care, but because they can't get the care and support they actually need closer to home where it would be better to provide it. So thinking about the health service in the context of the broader range of public services seems to me to be critical to this, and ensuring that those public services have the funds available, certainly, but also that they're planned in such a way to provide care and support to people in their home so that they don't need to go to hospital if it's not necessary.
Stephen Dorrell from the NHS Confederation, Adam Roberts from the Health Foundation, thank you very much for your time.
Let's see, time now is 8:20 and Matt's been keeping us up to date with the weather situation. How's it looking, Matt?